Part A. Extract 1. Questions 1 to 12. You hear a doctor talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Ms. Mihiraa. I'm Dr. Romy Home. What brings you in today?
Good morning, doctor. I've been feeling unwell for quite some time now. It's been almost a year, but lately, the symptoms have worsened, and I'm getting really concerned.
I'm sorry to hear that. Can you describe your symptoms in more detail?
Well, I've been experiencing extreme fatigue. I feel tired all the time, even after getting a full night's sleep. My appetite has decreased, and I've lost some weight without trying. My skin has become itchy, and I've started noticing yellowing in my eyes and skin. I've also noticed some swelling in my abdomen, which feels uncomfortable. It's not just the physical symptoms, though. I've also been feeling quite depressed and anxious lately.
That sounds quite concerning. Have you tried any treatments or medications for these symptoms?
Yes, I've tried a few things. I've been taking over-the-counter painkillers like paracetamol for the discomfort, but they don't seem to help much. My previous doctor prescribed me some antacids, thinking it was a digestive issue, but that didn't work either. I've also tried herbal remedies like milk thistle and turmeric, hoping they would help with the liver, but there's been no real improvement.
I see. Can you tell me more about your medical history? Any previous conditions or long-term medications you've been on?
I've had high blood pressure for the past 8 years, and I've been taking amlodipine for that. I was diagnosed with type 2 diabetes about 4 years ago and have been on metformin. I've been otherwise healthy, with no major illnesses before this started.
How about your family? Is there any history of liver disease, diabetes, or any other significant health issues?
Yes, my father had diabetes and hypertension. My mother had liver problems too, though I'm not sure what exactly it was. She passed away when I was young. My older brother has been diagnosed with fatty liver disease recently.
Thank you for sharing that, Mihiraa. I'd like to go over the results of the medical examinations you've had recently. Your blood tests show elevated liver enzymes, which indicate some form of liver stress or damage. The ultrasound of your abdomen revealed some irregularities in the liver's texture.
That doesn't sound good. What do you think is going on?
Based on your symptoms, medical history, and examination results, I suspect that you may have cirrhosis, which is a condition where the liver gradually becomes scarred and loses its ability to function properly.
Oh, I've heard of it before. Is it serious?
It is a serious condition, but with proper management, we can slow down its progression and improve your quality of life. The first step will be to start you on a low-sodium diet to help manage the fluid buildup. I'll also prescribe a diuretic to help reduce the swelling in your abdomen.
What about the itchiness and fatigue? Is there anything that can help with that?
For the itchiness, we can prescribe an antihistamine, and there are certain creams that might provide relief. As for fatigue, it's challenging because it's a common symptom of the condition, but improving your overall liver health might help.
What's the next step after this?
I'd like to schedule a follow-up appointment with you in 2 weeks to see how you're responding to the treatment. In the meantime, we'll arrange a liver biopsy to confirm the diagnosis.
All right, doctor. Thank you for your help.
Extract 2. Questions 13 to 24. You hear a physician talking to a patient called Mihiraa. You now have 30 seconds to look at the notes. Good morning, Mihiraa. How are you feeling today?
Good morning, Dr. Kidder. Well, my big toe has been swollen and painful. It started a couple of days ago, and it's gotten worse. The pain is so intense that I can barely walk.
I'm sorry to hear that. Could you describe the pain in more detail?
It started suddenly, about 2 days ago. It feels like a sharp, burning pain, especially when I try to put weight on it. The area around the joint is red, swollen, and very tender to the touch. I've even noticed that the skin is kind of shiny and warm.
I see. It sounds like the inflammation is quite severe. Has this affected your daily activities?
Absolutely. I haven't been able to go to work, and even simple things like walking around the house or putting on shoes are incredibly painful. The pain is constant, but it gets even worse at night. I've been feeling frustrated and helpless because it's limiting what I can do.
I can imagine how challenging that must be for you. Have you experienced anything like this before, or is this the first time?
This is the first time I've had pain like this in my toe. But now that you mention it, I have had some issues with joint pain in the past, particularly in my knees and ankles, but nothing this severe.
Alright. Let's talk a bit about your medical history and your family's medical history. Do you know if anyone in your family has had similar symptoms or conditions?
Well, my father had similar pain in his feet and ankles, especially after big meals or when he drank alcohol. My mother has rheumatoid arthritis, but I don't think that's related, right?
It's good that you mentioned your father's condition. This often has a genetic component, so it's not uncommon to see it run in families. Based on your symptoms and family history, I strongly suspect that you might be experiencing a gout attack.
What? Isn't that something older people get? I'm only 44.
While it's true that the condition is more common in older individuals, it can affect people of all ages, particularly if there are risk factors such as family history, diet, or other conditions like high blood pressure or obesity. Let's discuss the next steps for confirming this diagnosis.
What kind of tests do I need?
To confirm it, we'll start with a blood test to measure your uric acid levels. Elevated uric acid is often associated with the condition, although it's not definitive on its own. Additionally, I'd like to perform a joint fluid test. This involves using a needle to draw a small sample of fluid from the affected joint, which we'll examine under a microscope to look for urate crystals, which are a hallmark of the condition. We might also consider an X-ray to rule out other conditions that can cause similar symptoms.
That sounds a bit scary. What happens after the tests?
If the tests confirm that you have the condition, we'll start treatment right away. Initially, we'll prescribe nonsteroidal anti-inflammatory drugs to help manage the pain and swelling. The primary goals are to reduce the pain and inflammation during the acute attack and to prevent future attacks. If the pain is very severe, we might consider corticosteroids or a medication called colchicine, which is specifically used to treat gout flare-ups.
How long will it take for the pain to go away?
With treatment, you should start to feel some relief within a few days, but it can take up to 2 weeks for the symptoms to completely resolve. For long-term management, we'll need to look at lifestyle changes, such as dietary modifications, and possibly medications like febuxostat to reduce uric acid production.
Are there any risks with the treatment?
Like all medications, there are potential side effects. NSAIDs can sometimes cause stomach upset or increase the risk of ulcers, and corticosteroids can have side effects if used long-term, such as weight gain, increased blood sugar levels, and a higher risk of infection.
Thank you, Dr. Kidder.
That is the end of Part A. Now look at Part B.
Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a pharmacist called Mihiraa talking to a doctor. Now read the question.
Dr. Peter, I'm concerned about Mr. Bob's medication regimen. He's taking multiple medications for his heart condition and diabetes, and there's a potential for drug interactions.
Thank you for bringing this to my attention, Mihiraa. Let's review his medication list and identify any potential conflicts.
I've analyzed his medications and found that his blood thinner and one of his diabetes medications might interact, increasing the risk of bleeding.
That's a good point. We'll need to adjust one of the medications or find an alternative.
I've also noticed that Mr. Bob's current dosage of his heart medication might be too high. He's been experiencing side effects, such as dizziness and fatigue.
We should consider reducing the dosage or switching to a different medication.
I'll research alternative options and discuss them with Mr. Bob during his next appointment. Now look
at question 26. You hear a GP called Mihiraa talking to an orthopedic surgeon. Now read the question.
Dr. Peter, I'm referring Mr. Bob to you for a consultation regarding his persistent knee pain. He's been experiencing discomfort and swelling for several months.
Thank you, Dr. Mihiraa. I'll schedule an appointment for Mr. Bob as soon as possible. Could you provide me with more details about his medical history?
Certainly. Mr. Bob has a history of osteoarthritis and has undergone previous knee surgery. He's currently taking medications for pain management and inflammation.
Is there any recent trauma or injury to the knee?
No, he hasn't reported any recent accidents or falls.
It's possible that the knee pain is related to his osteoarthritis or a new injury. We'll need to conduct a thorough examination and consider imaging studies to determine the underlying cause.
I'll provide Mr. Bob with a referral letter and any relevant medical records. Please let me know if you need any additional information. Now look at question 27. You hear a radiologist called Mihiraa talking to a doctor. Now read the question. Colleagues, I'm excited to announce that we'll soon be implementing a new software update for our radiology imaging system. This update incorporates advanced features designed to enhance image quality, improve workflow efficiency, and ensure patient safety.
That sounds promising. What specific improvements can we expect from this update?
The new software will utilize artificial intelligence to automatically detect and highlight abnormalities in images. This will help radiologists identify potential issues more efficiently. Additionally, the update includes improved tools for image manipulation and analysis, allowing for more precise diagnoses.
Will this update require any changes to our current workflow?
There will be a brief training period to familiarize staff with the new features. However, the overall workflow should remain similar. The software is designed to be user-friendly and intuitive.
Are there any security concerns associated with this update?
We've implemented robust security measures to protect patient data. The update includes enhanced encryption and access controls to ensure the confidentiality of medical images.
Now look at question 28. You hear a physiotherapist called Mihiraa talking to a nutritionist. Now read the question.
Dr. Peter, I'm concerned about Arian's recovery from his recent knee injury. He's been struggling to regain his full strength and mobility.
That's understandable. Recovery from a knee injury can be a lengthy process. Have you considered the role of nutrition in his recovery?
Yes, I believe nutrition plays a crucial role. Adequate protein intake is essential for muscle repair and growth. Are there any specific dietary recommendations you would suggest?
A balanced diet with plenty of lean protein, fruits, vegetables, and whole grains is crucial. It's also important to ensure he's staying hydrated.
I'll advise Arian to consult with a registered dietitian to develop a personalized meal plan. Are there any supplements that could be beneficial for his recovery?
While supplements can be helpful, it's important to focus on a balanced diet as the foundation. However, we could consider supplements such as omega-3 fatty acids, which can reduce inflammation and support tissue repair.
Thank you for your advice. I'll work with Arian to incorporate these recommendations into his recovery plan.
Now look at question 29. You hear Chief of Surgeon called Mihiraa talking to a team. Now read the question.
Team, I'm excited to announce that we'll be integrating AI into our surgical procedures. This cutting-edge technology has the potential to revolutionize the way we perform surgeries.
How will AI be used in the operating room?
AI can assist in various aspects of surgery, from preoperative planning to intraoperative guidance. For example, AI algorithms can analyze medical images to identify potential risks and assist in surgical navigation.
Will AI replace surgeons?
Absolutely not. AI is designed to augment the capabilities of surgeons, not replace them. It will provide valuable insights and support, but human expertise will always be essential.
Are there any concerns about the safety and reliability of AI in surgery?
We've conducted rigorous testing and validation to ensure the safety and effectiveness of the AI technology. However, it's important to maintain human oversight and be prepared to intervene if necessary. Now look at question 30. You hear a nurse called Mihiraa talking to colleagues. Now read the question. Team, I'm excited to announce a new weekly routine shift pattern that will be implemented starting next month. This new schedule aims to improve staff morale, reduce burnout, and enhance patient care.
How will this new pattern work? Will it involve longer shifts or fewer days off?
The new pattern will involve working fewer days per week but with slightly longer shifts. This will provide staff with more time for rest and personal commitments.
I'm concerned about the impact on patient care. Won't longer shifts lead to fatigue and reduced alertness?
We've carefully considered this. We'll implement strategies to manage fatigue, such as scheduled breaks and opportunities for rest during shifts. Additionally, we'll ensure adequate staffing to prevent excessive workloads.
Will this new pattern affect our existing shift preferences or seniority?
We'll prioritize the needs of our staff and accommodate their preferences as much as possible. However, there may be some adjustments required to ensure a balanced distribution of shifts.
That is the end of Part B. Now look at Part C.
Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a microbiologist, Dr. Mihiraa, and an interviewer.
Dr. Mihiraa, thank you for joining us today. To begin, could you please give us an overview of your latest study on tuberculosis? What exactly does the study focus on?
Thank you for having me. This study is quite comprehensive in its scope, aiming to investigate the interplay between tuberculosis, TB, and chronic kidney disease, CKD, a connection that is often overlooked in medical research. Specifically, we are focusing on how latent TB infection may exacerbate the progression of CKD in vulnerable populations. Our research is distinctive in that it bridges the gap between two fields, infectious diseases and nephrology, allowing us to delve deeper into the systemic effects of TB on renal function. While TB is traditionally studied within the realm of pulmonary or systemic infectious diseases, its implications on kidney health, especially in patients who already have compromised renal function, are less explored. Our study is therefore shedding light on this niche, examining biomarkers, immune responses, and clinical outcomes in patients with both conditions.
That's fascinating and indeed a very niche area of research. Could you elaborate on how the study started, Dr. Mihiraa? What was the initial spark that led to this research?
The study's inception was somewhat serendipitous. It began with a routine observation in my clinical practice, where I noticed a disproportionate number of CKD patients who had previously been treated for TB were exhibiting faster progression of renal deterioration compared to those without a history of TB. This observation piqued my interest, and I started looking into existing literature. Surprisingly, while there were numerous studies on TB's impact on other organs, the kidneys were often sidelined. Collaborating with a team of infectious disease specialists and epidemiologists, we launched a pilot study to explore this further. Our initial findings, which indicated a potential link between latent TB and accelerated CKD progression, were compelling enough to secure funding for a more extensive, multicenter study. We designed the study to include a diverse cohort, taking into account different stages of CKD, varying TB histories, and a range of demographic variables. This holistic approach was crucial in forming the foundation of our current research.
The connection you're investigating is certainly complex, Dr. Mihiraa. What challenges have you encountered in conducting this study?
Indeed, the challenges have been multifaceted. First, there's the inherent difficulty in diagnosing latent TB, which does not always present clear clinical symptoms but can nonetheless exert a significant influence on other conditions like CKD. To accurately identify latent TB in our cohort, we had to employ advanced diagnostic techniques, including interferon gamma release assays, IGRAs, and molecular diagnostics, which are not only costly but also require a high level of expertise to interpret. Another challenge has been patient recruitment and retention, particularly given the vulnerability of our target population. CKD patients often have multiple comorbidities and are subjected to a heavy medication load, making them hesitant to participate in long-term studies. Additionally, the need to monitor both TB and kidney function over extended periods introduces logistical challenges, from regular follow-ups to ensuring patient adherence to the study protocol. Managing these complexities while maintaining the integrity of the study data has been a significant task for our team.
Given these challenges, it's impressive that you've continued to push forward. What are some of the latest developments in your research?
One of the most exciting developments has been our discovery of a specific biomarker that seems to correlate with both latent TB infection and accelerated CKD progression. This biomarker, a particular cytokine profile, was identified through detailed immunological assays and could potentially serve as an early warning signal for CKD patients at risk of rapid deterioration due to latent TB. We've also made strides in understanding the immunological interplay between TB and CKD, particularly how TB may exacerbate the inflammatory processes already at play in CKD. This has opened new avenues for potential therapeutic interventions, where modulating the immune response could mitigate the negative impact of TB on kidney health. Our team is currently in the process of validating these findings across different cohorts to ensure their robustness and applicability on a larger scale.
That's quite a breakthrough. What outcomes do you expect from this study, Dr. Mihiraa?
Our primary expectation is to establish a clearer understanding of the bidirectional relationship between TB and CKD, which could fundamentally change how both conditions are managed in patients who present with one or the other. We anticipate that our findings will lead to the development of new screening protocols for CKD patients, particularly in regions where TB prevalence is high. Moreover, by identifying at-risk patients early on, we can tailor more aggressive management strategies that could potentially slow the progression of CKD. We also hope that our research will pave the way for new therapeutic approaches that specifically target the immunological crosstalk between TB and the kidneys, possibly reducing the burden of both diseases simultaneously. In the long term, the goal is to improve patient outcomes by integrating our findings into clinical practice, ensuring that those with coexisting TB and CKD receive the most appropriate and effective care.
The impact of your study could indeed be far-reaching. Dr. Mihiraa, how do you envision this research influencing the broader medical community?
If our study's findings are validated on a larger scale, it could lead to a paradigm shift in how nephrologists and infectious disease specialists approach the care of patients with coexisting TB and CKD. By highlighting the interplay between these conditions, we can foster greater collaboration between different medical specialties, leading to more holistic and effective patient care. Additionally, our research could influence public health policies, particularly in TB endemic regions, by emphasizing the importance of screening for TB in patients with CKD and vice versa. On a broader scale, we hope to contribute to the global effort in reducing the morbidity and mortality associated with TB and CKD, which remain significant public health challenges. The integration of our findings into clinical guidelines could lead to earlier interventions, more personalized treatment plans, and ultimately, better health outcomes for patients worldwide. If our study's findings are validated on a larger scale, it could lead to a paradigm shift in how nephrologists and infectious disease specialists approach the care of patients with coexisting TB and CKD. By highlighting the interplay between these conditions, we can foster greater collaboration between different medical specialties, leading to more holistic and effective patient care. Additionally, our research could influence public health policies, particularly in TB endemic regions, by emphasizing the importance of screening for TB in patients with CKD and vice versa. On a broader scale, we hope to contribute to the global effort in reducing the morbidity and mortality associated with TB and CKD, which remain significant public health challenges. The integration of our findings into clinical guidelines could lead to earlier interventions, more personalized treatment plans, and ultimately, better health outcomes for patients worldwide.
Now look at Extract 2. Questions 37 to 42. You hear an endocrinologist, Dr. Hayden Joe, talking about the unforgettable journey in his career. You now have 90 seconds to read questions 37 to 42.
Ladies and gentlemen, esteemed colleagues. Today, I stand before you to share a profound experience that has left an indelible mark on my career as an anesthesiologist. The patient, Mihiraa, whose case I am about to discuss, is not merely a name in a medical record. Her situation presented complexities that challenged not only my clinical judgment but also my capacity to adapt, collaborate, and persevere in the face of extraordinary circumstances. Through this presentation, I will take you on a journey through the medical, ethical, and emotional challenges we encountered, the critical decisions made, and the outcomes achieved through a multidisciplinary approach. Mihiraa, a young woman in her late 20s, was diagnosed with a rare genetic disorder known as Ehlers-Danlos syndrome, EDS, particularly the vascular type. This condition, characterized by fragile blood vessels and connective tissues, presented significant anesthetic challenges. The rarity of EDS, combined with Mihiraa's specific medical history, made her case particularly memorable. She came to us for a complex surgery that was necessary but fraught with risks. The inherent fragility of her tissues and vessels meant that even minor errors could lead to catastrophic outcomes, such as arterial rupture or severe hemorrhage. But it wasn't just the medical complexity that made Mihiraa's case unforgettable, it was the human element. Mihiraa exhibited an extraordinary resilience, a rare combination of fear and hope that resonated deeply with me. Her trust in the medical team, despite the grave risks, was both a privilege and a heavy responsibility. Her case was not just about the medical challenges, it was about navigating the delicate balance between offering hope and managing realistic expectations, all while ensuring that every step was taken with the utmost caution and care. The critical moment in Mihiraa's care occurred when we had to decide on the type of anesthesia for her surgery. General anesthesia posed significant risks due to her condition, including potential cardiovascular complications. However, regional anesthesia, while minimizing some risks, introduced the danger of inadequate pain control and inadvertent injury during the procedure, given her hypermobility and fragile tissues. After extensive discussions with the surgical and pain management teams, we opted for a hybrid approach, a combination of regional and general anesthesia. This decision was not made lightly. It involved weighing the potential benefits of reduced systemic stress against the risks of inadequate anesthesia depth and the possibility of intraoperative complications. I remember the anxiety that accompanied this decision, knowing that any error could be life-threatening. The anesthetic plan had to be meticulously tailored to Mihiraa's unique physiology, with continuous monitoring and the readiness to switch strategies if necessary. Our responsibility to Mihiraa extended beyond the operating table. Post-operative care was equally critical, given her susceptibility to complications like poor wound healing, increased bleeding, and pain management issues. My plan to support her involved close collaboration with the pain management team to develop a customized analgesic regimen that would address her pain without compromising her fragile physiology. Furthermore, her psychological well-being was a major concern, as the stress of surgery and recovery could exacerbate her condition. Regular consultations with a psychologist who specialized in chronic illness were arranged, ensuring that Mihiraa's mental health was cared for alongside her physical recovery. The success of Mihiraa's case hinged on the seamless collaboration between various specialists. The vascular surgeons, hematologists, geneticists, and anesthesiologists worked in close coordination, with each team contributing their expertise. My role involved in not just administering anesthesia but also serving as a bridge between these disciplines, ensuring that all aspects of Mihiraa's care were aligned and that the surgical and post-operative strategies were coherent and unified. Frequent interdisciplinary meetings were held, where we discussed every detail of Mihiraa's case, from preoperative preparations to the potential postoperative complications. This coordination was crucial in anticipating and mitigating risks, ensuring that every decision was made with a comprehensive understanding of its impact on her overall health. The surgery was a success, with Mihiraa emerging from the procedure with minimal complications. The hybrid anesthetic approach proved effective, providing the necessary depth of anesthesia while minimizing cardiovascular stress. Postoperatively, her recovery was closely monitored, with interventions promptly implemented at the first sign of complications. The collaborative effort paid off, with Mihiraa's wounds healing better than expected, and her pain being effectively managed without significant side effects. The success of this case was not just a testament to the efficacy of the chosen medical strategies but also to the power of teamwork and the importance of patient-centered care. Mihiraa's case stands out as a defining moment in my career, not just because of the successful outcome, but because of the lessons it imparted. It taught me the value of humility in medicine, recognizing when to seek the input of others, understanding the limits of one's expertise, and the importance of meticulous planning in the face of uncertainty. This experience reinforced my belief in the necessity of a holistic approach to patient care, where emotional and psychological support is given as much importance as medical treatment. The success of Mihiraa's surgery was not just a professional victory, it was a profound reminder of the human side of medicine, where every decision carries the weight of a patient's life, and every successful outcome is a testament to the power of empathy, collaboration, and relentless dedication.
That is the end of your OET listening test. Now check the answers.